Zimbabwe has become one of the first countries in the world to roll out a national program for Lenacapavir, which is a long-term injectable HIV prevention drug administered just twice a year. And the move is being closely watched across the region. And here in South Africa, Lenacapavir has already been registered by the South African Health Products Regulatory Authority following a record speed review in October of last year, but it has not yet been rolled out. Now, the development is expected to feature prominently at the SADC Health Ministers meeting currently underway here in Sandton over the next 2 days, where regional leaders are reviewing health commitments, financing, as well as progress on HIV and Aids, TB, malaria, and epidemic preparedness. And to speak more on this, let's now welcome South African Medical Association Vice Chairperson, Dr. Zanele Bikitsha. Dr. Bikitsha, thank you so much. It's such a pleasure. So much hope for those currently seeking this life-saving injection, especially here in South Africa, where the number of those living with the disease is forever increasing. Any headway as to when we should expect the rollout locally? Good afternoon.
Good afternoon, and thank you for inviting me. Yes, this is exciting news indeed that we do have around Lenacapavir. Just to briefly answer your question, is that South Africans don't have long to wait. It currently is in the phase of being rolled out. There's already sites that are piloting it. Training is undergoing, for clinicians within the government sphere. So we actually don't have long to go. It's exciting times, in the management of HIV for South Africa.
Absolutely, Doctor. I mean, also the benefits of the rollout are far in many, looking at the current as well as alarming figures where the age of infection is even more prevalent amongst young girls as young as 14, and women in general being the highest carriers. Yet more men we hear are actually dying of HIV-related causes. So the need to really get this program targeted at these specialized areas of concern is quite key. Talk to us about these considerations, Doctor.
Okay, so what you need to keep into cognizance is that women are a very special population. So we end up catching them, and why you will see a lot more women on treatment is one of the reasons, the antenatal program. So obviously when women are pregnant, part of the rollout of the antenatal care is the HIV testing and management. So that's one of the reasons why you're going to see bigger numbers of women on your ARV treatment, but also generally health-seeking behavior from females is better than males. We tend to, look at our health a bit more seriously. So men, we tend to catch later on, and, they will be at a more advanced stage, or they will find out diagnosed through their partners. So that's why there's such a discrepancy between males and females, because there is another avenue where we do catch these women. But we also, have another group that we need to look at. It's the one that you're asking me to talk to, your LGBTQI population, who also, are engaging in what is considered the more high risk for infection. So this is also good news for them because, this enables more options for PrEP to be available.
Absolutely, Doctor. So let's just, for context, briefly go through how the injection will actually be administered, who can get the injection if we talk about the high-risk group, and, of course, the required proper usage so as to ensure its overall effectiveness. I ask this because it's still largely known, Doctor, that even those who are currently on ARVs or take PrEP or even use condoms, they still use them incorrectly, reducing the effectiveness of the medicine. And maybe talk to us as well about the safety on breastfeeding as well as pregnant women as well.
Okay. No, great. Thank you for actually asking that question. We need to get the message out to South Africans that, firstly, the injection is not something that you can play with. It's not something that is just going to be a magic bullet. It is what we call PrEP. So PrEP is pre-exposure prophylaxis. So it's a drug or a thing that you give to people that have not been infected or exposed. So this is for people that test HIV negative. So that's one of the criteria. You actually have to test negative. And obviously, you must be above your 35 kgs, just your adult weight. So it's for people that have tested negative. So that's one thing people must understand. And there is a difference between PrEP, which is pre-exposure, which is what Lenacapavir is, versus PrEP, which is post-exposure, like the one that we give to your rape victims or people that have been in a situation where maybe the condom burst. So this is for people that have not been infected or exposed. So that's the main thing that people need to understand. Then once you come, we'll obviously screen you. We will confirm that you have not, been exposed and currently are negative. We also ensure that within the past 72 hours, there is no incident that could, end up with you seroconverting. And we also do look at other things, your hepatitis and all those things, just to make sure that you're good to go. Once you are a candidate for this, we then are going to give you the injection, but you will be required for the first 3 days or so to take oral because it takes time for the injection to get to the level in your body where it's actually at a therapeutic range. So for the first couple of days, you will still have to take oral. So that is how then you'll be rolled out. And you will come back for a review. We will bring you back after about 4 weeks or so. But the injection is a 6 monthly, so you will need to take it twice a year. But we do review the first timer just to make sure Guti, we don't miss any serial conversion that might be going on. So yeah, that's basically how it's going to be rolled out. You did ask about pregnant women. Yes, for women, it's also said to be safe as well for pregnant women.
Awesome stuff. So, Doctor, what about those that are still undetectable at the time of testing and they become negative and then they actually do get to have the drug or the injection administered to them? And also talk to us, will it only be administered at private hospital or entities, or they can also just go to any public institutions and get it there for free? Talk to us about the costs involved as well.
Okay, so basically, when you're talking undetectable, you're talking about somebody that's on treatment. So that's a whole different kettle of fish that we're talking about. We in South Africa are not rolling out Lenacapavir as a treatment. That might come in the future, but currently, what it is being rolled out for is PrEP. So yes, you will be able then to come to the private sector, public sector, sorry, to get it. And I'm sure Kuti, there's negotiations with the private sector as well in terms of how they access stock. But just to make that clear, it's licensed as a PrEP currently, not as a treatment. So your undetectable implies that the person is already on treatment and that is working. So that's that. Then when you're talking about the cost, yes, obviously there is going to be a cost. When you've got these drugs, the issues around patents come about. So you end up, having to pay a certain price, which is why one of the reasons that some we believe we should be in South Africa manufacturing our own drugs so that we can cut the costs. And also to cut the costs, it's why it's not available to just everybody. It's a select few that we say will be able to give because you need to be able to guarantee your supply. We can't give it to the whole country. The next thing, we're not able to continue with the management.
Doctor, I think I used the wrong term there. I meant newly infected, those that are still, of course, not registering when you actually conduct the test. Maybe quickly address that one. And then maybe in terms of overall effectiveness, then, is it 100% HIV proof? Because we also understand that at the side, there's still concerns that remain around the fact that the injection doesn't protect one completely against other sexually transmitted diseases, meaning usage has to also be along with healthy sexual choices.
Absolutely, you're right. So if you're talking about those ones that have just now become positive, that's why we ask you about your previous 72 hours. Because if within the past 72 hours you've had what is considered a high exposure, we then need to manage you a little bit differently just to make sure that serial conversion doesn't come into play. But also, if you're a first timer, that's why I said to you, remember, we call you back within the space of a month.
Yes.
So that should then assist us to pick up any people that are serial converting. So that's why we have the issue of the 72 hours and also monitoring you before the 6 months just to make sure that serial conversion, is excluded.
All right.
And, you're absolutely correct. This is something that is going to assist in preventing HIV infection, but it does not speak to any other STIs if you are going to continue with unprotected sex. Because remember, there's other methods of contraception. There's your barrier methods that you need to use as well, so that you're not exposed to other diseases. And it also does not speak to pregnancy as well. So that needs to be taken into consideration. And if a person is responsible enough to enroll themselves on this program, I would hope that they would make sure that they are complying with the other measures, so that even if the partner is somebody who is got unmanaged viral loads and all of that, you are not reinfecting yourself. And then despite what you're doing, you end up converting. So that's why the two need to go hand in hand.
Oh, absolutely. What a wonderful engagement. Thank you so much for that informative discussion, Dr. Zanele Bikitsha, the summer vice chairperson, weighing in on the rollout of the entire HIV injection, Lenacapavir, particularly here in South Africa. And she says we are almost there. It should be rolled out very soon.